Lexington's morning news continues on News Talk 590 WVLK. And now, here's Jack Patty.
Once a month, we get Dr. Kavanagh in the studio with us, and he is here today. He's a retired ENT from Somerset and also founder of an organization called Health Watch USA. Good morning, Dr. Kavanagh.
Oh, good morning, sir.
What is Health Watch USA?
Well, Health Watch USA is a nonprofit organization whose mission is to promote healthcare quality and transparency. And transparency means that patients or the customers of healthcare will know what the cost and quality is. And we feel that that will aid in driving lower cost, higher quality care.
And you've had some success. In fact, quite a bit of success, and you're getting attention through many of the editorials that you've written, have been published in several papers, as well as some health organization reports and that kind of thing, right?
Yes, I think we are having an impact on national policy, but you have to remember it's a big sea out there, and so no one person or one group is going to be able to really move the needle. It takes a lot of effort from a lot of people in order to do that.
We have a special guest this morning, and why don't you introduce us to her at this point?
Yeah, I'd like to introduce Leah Binder, who is president and CEO of the Leapfrog group. Now this isn't the children's group. This is a national nonprofit organization that's based in Washington, D.C., and represents employers and purchasers for healthcare and basically trying to improve the quality and safety in hospitals. The organizations that she represents, for example, are the AARP, Boeing, CBS, FedEx, General Motors, Verizon, along with 30-plus other organizations that do the same thing. So this is a huge organization. They have a hospital rating system that I feel is very important, and we're very privileged and lucky to have her with us.
Leah, good morning.
Good morning. It's my privilege.
I tell you what, Kevin told me this morning, he says, you know what, she's really a big deal. We're lucky to get her. I said, I think that's kind of a left-handed compliment, but thank you very much. It is good to have you here this morning. Thank you for taking time to be with us.
Thank you for having me.
Tell us exactly what the Leapfrog group is and who exactly you represent.
Well, we represent large purchasers of health benefits, just as Dr. Kavanagh said. We represent companies like Boeing or Marriott, as well as business coalitions on health that also represent those kinds of companies in their local level. A lot of companies spend more on health benefits than they earn in profits in a given year. It's a lot of money. So they're really interested in knowing what they're getting for that money. Are they getting high-quality care for their employees? And unfortunately, the answer too often is no. And that's what we represent.
We hear over and over, Kevin, and have mentioned this on the show many times. I don't know the exact figures, but don't we spend more on medical care in this country than most countries in the world?
Oh, yes.
And
definitely by far. Yeah, like number two is way behind us.
Yep.
We're about at least a third more than the next highest nation.
Yeah, I think we beat out Cuba.
Good for us. Now, you rank hospitals, is that right?
Well, we rate them.
Yeah.
First, we ask hospitals, as Dr. Kavanagh mentioned, we have a survey. We ask hospitals to publicly report on issues that they otherwise aren't required to report on, which is surprising to many people. But most hospitals, for example, till very recently, weren't required to report anything about their infection rates, especially in certain states. So we didn't have very much information about infections, didn't have very much information about the kinds of accidents that happen in hospitals that can be really harmful. Some of them are pretty squeamish, like removing the long limb and surgery or things like that. Those kinds of things that happen in hospitals, we just had no way of knowing. So my organization, on behalf of these very large purchasers of health benefits, so they have some leverage, hopefully, in the market, asked hospitals to report to Leapfrog so we'd have a systematic way to collect that information. So hospitals that don't report to Leapfrog, you have to wonder why they're not reporting. It's national. We have almost 1,500 hospitals across the country reporting, which is about a third. Hospitals do report, but many still don't, even when they're asked to by some of these large purchasers.
What about
so we do that, and then the other thing we do is we rate hospitals on how safe they are. We give them a letter grade.
But percentage-wise, how many don't respond? Do you have any idea?
2/3.
Don't respond?
Yeah, and and we're considered the premier tool for transparency.
So
There's nothing better, and unfortunately, we only get a third.
What do you make of that?
We're proud of it.
What do you make of that?
Well, the hospital community spends quite a lot of resources lobbying legislatures so they don't have to report some of this data. And so I guess it shouldn't be surprising that when they're asked to do so voluntarily, they also don't want to do it. So we see, unfortunately, that there are a good number of hospitals that have something they don't want to share with their community. And the community, the best way to respond to that is to call them up and ask them where's their results. Because there is no other way. So if you have two options. You can go to the legislature and demand that your local hospital report their infection rates, or you can tell them and ask them and tell them that it's important to you that they report to Leapfrog. Those are your two options to get that. And in my mind, if as a resident of a state where not enough hospitals report, I live in Maryland, my options, I'm going to use both.
Oh, yeah, and I think that a classic or big example of what you're talking about, lack of transparency, is that hospital accreditation surveys. There is even a law which prohibits the federal government from releasing them. And this is, like in a state inspection, a restaurant inspection. There is a law in the statutes that says that the Department of Health and Human Services cannot release a hospital survey without the hospital's permission. And I mean, how basic can you get of information that the public should have? That they got a law passed to not even release that. And so I think it's fairly frustrating when you try to get good information out of hospitals, and then of course they're always complaining the information's bad, but yet the biggest impediment to getting good information is, I feel, is the complainer.
I have to say that's true. And the accreditation report, what compounds that is that most hospitals would close down if they couldn't get Medicare funding. Medicare is a big payer. So they would close down. In order to qualify for Medicare funding, which, by the way, is taxpayer dollars, you can look at your paycheck and see how much you're paying for Medicare, they have to pass an accreditation. It's that same accreditation report that is unavailable to you and on any of us in the public. So it's really something we have to change.
This is David first. Hey, David, good morning.
Good morning. First of all, I'd like to say thank you to Leah for the work she does with Leapfrog. I was one of a large cluster of patients injured at the Cleveland Clinic in their urology department, and that rating that Leapfrog had gave last year to Cleveland Clinic was not out at the time I had my surgery, unfortunately. One of the things I'm curious about is the lack of patient input. I reported a large cluster of injured patients to CMS. They investigated. They found that they cited Cleveland Clinic for many violations. However, patient outcomes and the negative surgical outcomes were not included in any of the reports. Those patients made efforts to contact CMS, medical boards, and so forth. Is there any effort by your organization to bring in patient inputs into your evaluations of hospitals?
We would very much like to do that right now. In fact, we are working with CMS to see how we can do that. We have a board member, his name is Marty Hatley, and he runs a patient advocacy organization that has been working with Partnership for Patients, which is part of CMS, to incorporate patients into quality reporting, but also into operations of hospitals. So establishing, true patient advisory committees, not rubber stamp committees, but groups that really have influence in the operations of hospitals. So this is a big battle. There's a lot of opposition to doing this, and it's not usually stated outwardly. You won't hear a hospital say, "Oh, we're against having patients involved," but they do behind the scenes work pretty hard to oppose that. So I'm sorry to hear about your experience, and we are working to see what we can do.
Well, one of the problems that I see is that you have hospitals with tremendous marketing efforts, and the real truth is not transparent. And again, thank you so much for what you do, and I'll hop off the line now.
Thank you, David. We do appreciate your call. Let's go to Clay. Clay, good morning. You're on the air.
Yeah, I was just wanting to know what hospitals in Lexington, how they're rated, and if any of them are refusing to let us know about their accidents you have or whatever's going on?
I tell you, that's certainly something we're going to talk about, and we'll do it right now. But Claire, I'm going to let you hang up and listen, okay? Because this will probably take us a while.
Okay.
All right, thank you. Yes, sir. What information, Leah, do you have about Lexington hospitals particularly?
Well, let me start with Central Baptist Hospital. That is a hospital that does not report to Leapfrog. That would be one to approach. I will say that they do pretty well on our hospital safety score. And let me just back up and tell you about our hospital safety score.
Okay.
That is where we give a letter grade to hospitals on how safe they are for patients. And safe means, do they prevent patients from getting in accidents or having a medical error, something awful happening to them in the course of their treatment that has nothing to do with what brought them into the hospital. So, for example, if you go in the hospital for a knee replacement and then you end up with an infection that leaves you there for 10 days, that infection is what we're going to look at. We want to know those things. They are very common. Now, for anyone who doesn't know about patient safety, they're usually shocked to know that 1 in 4 people, this is Medicare data, 1 in 4 people admitted to a hospital suffers some form of an error. 1 in 4. You know, you really have to try hard to get to 1 in 4. Think about that. Would you get in your car right now if you thought you had a 1 in 4 chance of being injured during the trip? Most of us wouldn't. It is hospitals can be very dangerous, but they're not all the same. And some are safer than others. In fact, some are much safer than others. And so, for Leapfrog, from our point of view and those of our members, we believe that the first thing you look at is safety. You want to make sure that you or your family member is safe when you go in the hospital.
Right.
That they're going to take precautions. Then you also, after that, want to look at, is this the right hospital for my condition? So if I need that knee replacement, is their orthopedics department any good? We're not going to necessarily rate them on their orthopedics department, but we're going to tell you if they're safe, and that's the first thing you should look at. We give them a letter grade, A, B, C, D, or F. The gentleman caller before mentioned Cleveland Clinic. We have given Cleveland Clinic a D, and we gave them a C in the last round of scores. We update them every 6 months. It has a big name, but they've got major problems with safety at that hospital. So it is always worthwhile. Don't assume that you know because the name's so good it must be safe. Never assume that. We are surprised all the time by some of the grades we see.
Okay. And what about Central Baptist? You said you gave them a what?
The recent score, they got an A. So they're doing okay now. They have some problems. Nobody who gets an A is automatically safe. You always have to take precautions in a hospital. But overall, in the 28 measures that we looked at, they did pretty much better than the national average on almost everything that we can measure. We don't know everything about them because they have not agreed to report to Leapfrog.
I was going to say, they didn't report to you, so what are you basing your information on?
We're basing it on information we get from the federal government.
Okay.
It does report some. And it's enough. We have a panel of experts who say this is enough data that we'll use to feel comfortable with a letter grade. And so we get enough from them. But I think that if I lived in your community in Lexington, I would ask them to please report because there's more information we could have to base this grade on.
That's Baptist Health now. All of us who've lived here for a long time will probably continue to call it Central Baptist. How about St. Joseph East?
Well, St. Joseph East has some challenges. They earned a C from us, which is really not a great grade. I will say that they're transparent. They have reported to Leapfrog. They just started. And so that's good news. I think typically hospitals that just start reporting to us tend to show real improvement. I think sometimes just having to publicly acknowledge your weaknesses can have a galvanizing impact on safety. So I would feel very good about this hospital's progress. But right now they are at a C, and they have some issues. I mean, they definitely are worse than the national average on some pretty, frightening kinds of things that can happen, accidents in hospitals.
All right.
But again, they're clearly, they're on the right track.
This is Charlie. Good morning, Charlie.
Good morning. I like the work that you're attempting to do in the transparency of hospitals. I understand it's an uphill battle. But you're talking about the hospital, it's like an entity, comprised of groups of doctors. I, as a patient and having gone to the hospital for things and doctors all the time, I don't really look into the hospital or the doctor's office. I look at the doctors, and the way I get information from that is either word of mouth or today, you go to their websites and you see their curriculum and see them boast on themselves, and they post some positive testimonials perhaps. And my question is to you all is there's initiatives by doctors to have any negative comments removed from any of those sites that they have, their own websites or comments and things. And to me, that's just, kind of stacking the deck to their benefit. And I wonder if y'all have any type of solutions or preventions against that, or a better way patients can speak up and inform other people about negative experience that they've had with certain doctors, so it's not just getting swept under the rug.
Charlie, before Leah responds, Kevin, you had something to say.
Yeah, I think that hard data is the answer to that. There's a huge disconnect between safety and reputation. Mm-hmm. And it kind of makes sense. If you're a large institution, teaching institution, and you want to have cutting-edge technology and you spend $2 million getting this, it could even be more than that, getting this up-to-date robot that can do everything under the sun plus cook coffee and bacon in the morning. Mm-hmm. You may not have that much money left over for your housekeeping, nurses, making sure that everything is clean, that patients are adequately staffed and turned and mobilized. You start cutting back in other areas, especially when you're under a lot of financial stress that we're seeing with healthcare reform, and that's where safety problems start to occur. And if you look at the Cleveland Clinic example, although CMS had Cleveland Clinic on a termination track, Leapfrog gave them a D. U.S. News and World Report, which is, I feel, largely reputation-based, had them ranked extremely high in the top 10 hospitals in the U.S., and Joint Commission gave them a gold seal. Of course, the Joint Commission data, the problem is the initial data is hidden. What you see on their website is after remediation, kind of like getting a test. You get to correct it and then take the corrected one home. Yeah. So it's a big disconnect between reputation. That's why you need reporting and hard data.
Charlie, thank you for your call. Leah, what do you say?
Yeah, a couple things. One is it is really important for you to, quote, shop for hospitals. Most people do think, as the caller does, that you just go where your doctor tells you to go. But one thing to consider is this. When you're in a hospital, most of the care you'll be getting, the vast majority of it, is not going to come from your doctor. In fact, it may not come from doctors at all. Most of the care you'll get will come from nurses and other workers in that hospital. So the hospital's overall atmosphere, whether it respects the work that nurses are doing, whether it actually values the little things that make such a big difference for you, like Dr. Kavanagh mentioned turning. If you don't get turned, you're going to get an excruciating wound. So there are things in a hospital that are really important. So it is very critical for you to look at the overall safety of the hospital before you walk in those doors.
You, in the break, I was asking Kevin, Leah, you guys do not rank or rate veterans hospitals. Is that right?
No, we'd love to, though. In fact, I just wrote a blog. I have a blog on Forbes, and just wrote about how really we deserve to know how VA hospitals compare to rest of hospitals. I mean, there's a lot of talk now about should we privatize the VA, et cetera. Mm-hmm. Well, that assumes that the private sector is doing a great job with hospitals, and we actually don't have good evidence of that, as I've mentioned. Unfortunately, there's so many problems in hospitals that are not VA hospitals. However, we certainly, and veterans certainly, deserve to know how their hospitals compare, and we don't have anything that we can use to make that case, and I think that should change.
All right, let's go back to the phones. This is Joe. Good morning, Joe.
Yes, ma'am. Thank you for taking my call.
Sure.
I live in Bourbon County, and just was wondering about a situation. Back in December, my wife went in for a hernia operation. They wound up doing a bowel reconstruction on her, never fixed her hernia, and she wound up spending 16 days in the hospital because of infections. She had IVs in both hands and both feet. The doctor still hasn't done her hernia surgery, and he sent her to, I bet you, 15 different tests and other doctors, and we can't get anybody to tell us anything.
Yeah, I think it's a problem that is, when you hear these, of course, it makes you cringe. And unfortunately, it's all too common. And you can argue that even one case is too common, but I think it's, from what I hear, a lot of these incidences, not only do they occur, but then the patients, because of what I call a defend-and-deny culture, don't really get the information, and that just infuriates patients and families more. And it has to do with, a culture of safety. A lot of people can say, how can you rank a single hospital with just, one letter grade to, encompass everything? But it has to do with the culture of safety. And hospitals that have a defend-and-deny culture, that do not value nursing as highly, that are short-staffed on nursing, tend to fall down everywhere on safety, not just in one particular area. And by far the best way to diffuse a situation is with transparency and saying, look, we made a mistake. Maybe the bowel was nicked inadvertently while doing a hernia, which is bad, but it's not unheard of, and it can happen. But when you get into a denial, not talking, the family just imagines things that are far worse than probably what really happened, and it just, I think, escalates.
And what was really strange, I met an old friend, and he went in for a hernia surgery, and same doctor, same hospital. He was supposed to be outpatient. He wound up spending 12 days.
For what reason?
During infections.
Oh, an infection. What do you say, Leah?
Well, I just want to express my my sympathy. That is horrible to be going through what you're going through, and you deserve to be treated with humanity over this, and clearly that's not happening from the hospital if they're not even talking to you. You need to, you can file some complaints probably with your state health department, the Joint Commission. Sometimes those can help. You certainly need to see a different doctor and probably go to a different hospital and see if you can get the care you need and deserve. But hospitals and providers often complain about too many malpractice suits, and we could argue about that for another radio show. But I will say that the number one best way to head off a lawsuit that's known is a simple apology. And what you deserved was a simple apology, and someone to sit down, tell you what happened, what mistake was made, and how they're going to help you recover. But unfortunately, that does not appear to be what you're getting. So I wish you the very, very best. That is a terrible
thank you all for your advice.
Thank you, Joe. I appreciate your call, sir. This is Ann. Good morning.
Hello.
Good morning.
My question is, I just walked in and heard you talking at the very end about having given a grade to the Baptist Healthcare Hospital.
Yes.
And then you went to St. Joseph.
St. Joseph East, yes.
And I missed the grade that you gave the Baptist Hospital, and I wonder if you'd just tell me what that grade was.
All right, that was an A, and I appreciate your call. Kathy, good morning. Kathy, good morning.
Yes, good morning.
Yes.
My name's Kathy Day. I'm from Bangor, Maine, and I have the Leapfrog report in front of me. And my local hospital, Eastern Maine Medical Center, has an A rating in the Leapfrog report, and yet a week or so ago it was announced that there may be Medicare penalties for preventable harm to patients. And I just wondered how you can relate the two. An A rating with penalties coming from Medicare. And thank you for your answer.
All right, you going to hang up to listen?
Yes.
Okay, thank you, Kathy. Leah?
I just want to note, I'm born and raised in Maine, so I'm glad to hear from a Mainer. We use the best possible available data, but we do not live in a transparent world, so we don't have everything. And Medicare has a lot more information that they don't make available to us that we cannot use. So when they know of something, luckily in this case, they step forward immediately. I wish I could say, oh, well, we use everything there is, and we will make sure that this rating is perfect. It is not going to be perfect. And we always say, as I said earlier, referring to an A, never trust that a hospital is perfectly safe no matter what grade we give them. But we do think that, relatively speaking, this hospital is, based on what data is publicly available, we think this hospital is safer than others.
Yeah, and I think the hospital-acquired condition data has been one data set that has had the most effort on the part of consumer advocates trying to get transparent, and in my opinion, has really been under a veil of secrecy. The data tends to be old. Even with the penalties that have been levied, you don't know which complications were involved with what hospitals. And I'm not sure as of yet it's been made available. It may be on a data file on a huge spreadsheet that you can download someplace, but it's not very transparent on Hospital Compare. In fact, that data set, the last time I looked, was taken off of Hospital Compare.
Coming off. We've been fighting it. So here's an example of what's coming off. If you want to know if the hospital down the street from you left an object in after surgery, so left the sponge in the body cavity after surgery, that would seem important to most of us. It's the #1 most reported sentinel event. It would seem important. Well, as of this month, CMS will not report that. So you will have no way of finding out that happened.
Yeah, and that's what you're up against when you're trying to get these rating systems. If there's useful data that's out there that the government has that all of a sudden comes off, and again, it's because you've got other individuals and industries trying to, I think, put a veil of secrecy over what the public is able to access.
One of our e-mailers this morning wants to know the score or the rating of the University of Kentucky.
C.
C.
They've got some problems, and they do not report publicly voluntarily to Leapfrog, so I would encourage them to do so. But they do have some challenges. They've had some very significant, we look at about 13 events that could happen that are untoward, some big errors and problems, infections. And on 8 of them, that hospital was well below the national average. In other words, worse than the national average.
Here's an email from Steve. Said, I spent a week at Baptist last fall. They may be safe, but there's still some issues, real issues over there. They're building like crazy, but no new patient rooms. The new quote-unquote healthy cafeteria is awful. I couldn't eat anything they brought me. This is a huge change from how they used to be. Thank God they have top-notch nurses there. Otherwise, I'd say stay away. There are other considerations to look at besides safety. Patient comfort and family comfort are important, too. Do you have anything in your reporting that deals with that particularly?
We'd like to. We just don't have access to any information that's systematic nationally on that we use. But it is a very important point. But again, I go back to this. What we look at is the very baseline. Are you going to be safe, somewhat safe, or safer than other places from an infection or something that could potentially kill you in that hospital? And when we look at Baptist, we can't say that they're perfectly safe. Nobody's perfectly safe by any means. But compared to other hospitals nationally, at least from the data we have, they seem safer.
As we go back to your calls, and Jim, good morning.
Good morning, all. Interesting topic, very good information. Coming from the healthcare community myself, I'd like to throw out something else. This information obviously is extremely important to the public, but something that I would like to see the public keep in mind, and I see it all the time. Something happens and people panic. All of a sudden, like a sponge is left in someone's abdomen. Oh my goodness, it's happening every time there's a surgery. No, it isn't. I know it happens and it shouldn't happen, but does it happen in 1 in 10, 1 in 100, or 1 in 1,000, or maybe 1 in 10,000? A lot of times, newspapers, especially newspapers, and sorry to say the media in general, tends to play this up. Like in the newspaper business, there is unfortunately a line that says, if it bleeds, it leads. In other words, the bad news is what gets the attention. Mm-hmm. And the general populace needs to be aware, yeah, it happens, but it's not happening every day. And some of the like these A grades that you're talking about, to a great extent, I think illustrates the fact, no, it doesn't happen every day. Relatively speaking, things like this are probably a rarity. It needs to be addressed, of course. But I wish people could keep it in mind keep it in perspective.
Well, if 1 in 20 patients used to develop infection, now the new number is 1 in 25. You've got 1 in 7, at least 1 in 7 patients, according to CMS on Medicare, that are developing an adverse event. I think that unless you're just seeing 1 or 2 patients a day in the hospital, these are a daily event. I would not, in any way, shape, or form, tend to mitigate this as not being a problem. It is a huge problem. And if it's not a problem, then why isn't the data transparent? I mean, produce the data, produce your survey results.
Oh,
This is what needs to be done. Why are you taking the data off CMS? I mean, get the data out there so we can see that it's not. I mean, I have to disagree with you 100%. I would say that mainly, your example of leaving a sponge in someone is probably cherry picking. That does occur sort of rare. But if you talk about getting a C. difficile infection or an MRSA infection, that's not rare at all. Those, in my opinion, are almost daily events, and that's what the data shows.
I have a sister-in-law who was admitted to a hospital in eastern Kentucky. Was there? They were looking into, I don't know what caused it, but she was suffering symptoms of pancreatitis. She was in the hospital for 5 days and left with a C. diff infection. So, yeah, I know exactly what you're talking about.
Right. Yeah, and there's hardly to find a family now that doesn't have a member that hasn't gotten one of these infections.
It's happened in my family. Thank you for your call, Jim. What do you say, Leah?
I would add that the most common error in hospitals is, in fact, a daily event, literally. There's one, on average, there's one medication error per day, per inpatient in America. And I would add another thing that's kind of disturbing in the course of this today's discussion. About 50 people will die from one of these errors or accidents. So this is actually a very serious problem, and it's flying under the radar because of the lack of transparency. And we all have a role to play in changing that.
All right, this is Jerry. Good morning, Jerry.
Good morning. How are you all doing?
Doing well, thank you.
I hope you can hear me. I got a bit of a vocal cord problem, but I got a quick question on behalf of my stepfather.
Yes.
Three years ago, he had a bladder cancer operation.
Mm-hmm.
For the next 3 years, after he got out of surgery, he kept going in the hospital 2 or 3 times a week, emergency room and ambulances and everything, for 3 years. So they finally found out from an infectious disease doctor that during the surgery, they had left 7 of these little staples, is what they're calling them, staples. They actually found 5 of them that was causing the infection. Everybody agreed on this, that that's what was causing the infection. They left 2 of them in, and when the poor feller was going to the restroom, they came through. When he was going to the bathroom, they came through his urinary tract. So the hospital had 5 of them that they took out of him, plus they left 2 in. We've had 2 different lawyers that's looked at the case. Both of them have said, oh yeah, definitely, you got a case.
Two different lawyers, is that what you said?
Yes, sir.
Okay.
And both of them have had to cancel out because they call it a conflict of interest, because they're already suing this doctor in a class action lawsuit. So they dropped my parents' lawsuit and don't find another lawyer.
Okay, let's do a comment.
It's very hard
Thank
to
you,
comment.
Jerry. Why don't you listen off the air, okay, Jerry?
Yeah. It's very hard to comment on particular cases, but, surgical staples or even suture, that's what you use to bind things together.
Yeah.
I don't think there's an alternative to not using those. Getting an infection is what is, what is of concern, and to make sure that places are clean, and that a patient has the proper preoperative antibiotics and he has the proper care to try to prevent getting an infection. And, that's kind of what I think the case is more about, rather than that a surgical staple or a suture was used, because those are commonly used.
Leah?
We asked hospitals in our survey that I mentioned that we asked them, do you have a never events policy? Because what was just described, if in fact it is as described, and I don't know the situation obviously, but
sure.
if it is, it's what we would call a never event. It should simply never happen. And we ask hospitals, in the case of a never event, if it does happen, do you apologize? Do you not charge for the event or for its fixing the patient after the event? And do you report it to the appropriate authorities? We ask them those simple questions. Any other industry, they would do that. If there's a, if a company has a terrible event, like car companies where they've had problems with the accelerators, they immediately apologize to the public and they make good on it. But that is not something hospitals automatically do. We ask hospitals about that. About 75% of the hospitals who voluntarily report to us do in fact have that common sense never events policy, but that means a quarter don't. So that is another area where we really need improvement from hospitals. It's time we stop having to rely on the courts to do what we all deserve.
Leah, we're out of time, but I can't tell you how much we appreciate you being with us this morning. Thank you very much.
Thank you for having me.
You bet. And as always, Kevin, a pleasure, sir.
Thank you, sir.
We will see you next month.